Hello guys, how are you doing? Let's start our today's 5 questions, all from INICET November 24 OBG. I want you guys to answer this question because this topic is very important. We would have come across this topic during our internship also. We also read long answers for this during our final year preparation also. So I want you to answer this question in the comment section, because if I explain this, it takes a lot of time. So I want you guys to answer this question in the comment section. So the question here is: a female with abdominal pain and bleeding to vagina with 3 months of amenorrhea. On examination, her BP was 90/60. Which of the following is or are true about ectopic pregnancy? So ectopic pregnancy, the most commonly repeated topic. We need to know everything about ectopic pregnancy, and this has also been asked now in the previous INICET. So the options here are, so they're asking which of the following are true. The options: abdominal pain is the most common presenting symptom of ectopic pregnancy and may be present in at least 90% of patients. B. PID, that's the pelvic inflammatory diseases and the sexually transmitted infections are a major risk factor. Option C. Low values of progesterone are usually diagnostic of ectopic pregnancy. However, there is no specific value to completely rule out or exclude ectopic pregnancy. Option D. Oral methotrexate is a viable medical alternative to surgery in ectopic pregnancy patients with shock or renal failure. What do you think is the right answer to this question? Here, it's a combination answer: 1 and 2, 3 and 4, 1, 2 and 3, 1, 2, 3, 4. Which of the following is the right answer? What do you think? Comment below in the comment section. Coming to the second question, this is also a very important topic. Which of the following is the smallest pelvic diameter at the brim? Obstetric conjugate, diagonal conjugate, anatomical conjugate, true conjugate. What do you think is the right answer to this question? This is purely a memorizing type of question. If you remember this, see, what I feel about NEET PG exam is, even though some of the questions are conceptual, among the 200 questions, nearly 150 questions are based on facts or pure ratamaro stuff. If you remember that, you know the answer. If you don't know, that's like that only. Only 50 of the questions are highly conceptual, or if we use our brain, we can answer that. Or else all the remaining 150, nearly 100 to 150 questions, they may be long stem questions or they may be simple one-liners. They only need us to, they only question our remembering skills. If you remember that, you know the answer. If you don't remember, don't know the answer. So whatever you read, try to just remember things, because the exam, the NEET PG exam is only about remembering things. Here, the answer over here, as you marked out correctly, is the obstetric conjugate. As you can see in the image, we know the distance between the sacral promontory and the upper border of the pubic symphysis is the true conjugate. True conjugate is also known as the anatomical conjugate. In this option, he gave the true conjugate and anatomical conjugate as separate options, but they both mean the same. And the distance between the mid portion of the pubic symphysis and the sacral promontory is the obstetric conjugate, and the distance between the sacral promontory and the lower part of the pubic symphysis is the diagonal conjugate. As you know, diagonal conjugate is the measurement which we measure manually by you know the method. So the obstetric conjugate is the shortest one. It measures about 10 centimeters, 10 to 10.5 centimeters. It is the shortest pelvic diameter at the brim. So here the answer is obstetric conjugate. A similar question has also been asked in the NEET PG 22. As you can see, he marked out that portion and asked what is that known as. So it's simply a labeling type of question. Coming to the third question, a 35-year-old P2L2 woman presents with malodorous vaginal discharge and normal cervix. Fifth test is positive. What is this condition? The options here: Candida, Chlamydia, bacterial vaginosis, PID. There would not be a single NEET PG aspirant going to the exam without studying this topic. this topic is that important, so we should never forget this question, and before the exam we need to definitely revise this topic also. As you can see, candidiasis is by the candida, as we know, bacteria, and the pH is less than 4.5 here. Alkaline pH more than 4.5, we have the bacterial vaginosis and trichomoniasis. Bacterial vaginosis is caused by Haemophilus vaginalis, also known as the Gardnerella vaginalis. Here the VIF test is positive, and here the Amsel's criteria is also positive. VIF test is nothing but the secretion plus 10% KOH. We have the fishy odor here and also the clue cells. They can simply give the image as shown here and also ask what is the diagnosis. Because even in the NEET PG 24, he asked some pap smear also. We'll discuss that question in our NEET PG 24 revision. But now let's revise this. Trichomoniasis, as you can see, colpitis macularis, that is the strawberry vagina. Candidiasis, there will be out of proportion pruritus. In trichomoniasis, severe pruritus, but no pruritus in the case of bacterial vaginosis. You would have revised this 100 times also by now, or else if you didn't revise this today, and also one day before the exam, don't forget to revise this topic here. Therefore the answer would be bacterial vaginosis. Coming to the fourth question, which of the following does not constitute as germ cell tumor? Yolk sac tumor, dysderminoma, juvenile granulosa cell tumor, non-gestational choriocarcinoma. No person in this world will think that this is a INICET November 24 question. Even all of the questions here are from INICET November 24 only. This question is that simple. What happened to me in this question was, I read everything about the ovarian cancers. I read all the classifications. I know all the things, but I got confused. Which of the following is a germ cell tumor? So I was confused. I know all the specificities of everything, but I don't know the classification itself. So he asked this question. You might think this might be very silly, but we often do silly mistakes also. So my lesson that I learned, I want you also to learn, is don't forget the basic things. Here he just tested the basic concept here. Which of the following does not constitute the germ cell tumor? As you can see in the classification, we have the surface epithelial stromal tumors, sex cord stromal tumors, germ cell tumors. The metastatic cancer from non-ovarian primary, let's leave that. In this classification, in the sex cord stromal tumors, we have the granulosa tumors, fibromas, fibroticomas, ticoma, Sertoli-Leydig cell tumor, and the steroid lipid cell tumor. Even Sertoli-Leydig cell tumors has been asked many times in a NEET PG. Coming to the germ cell tumors, we have the teratoma, which are the immature and the mature, dysderminoma, yolk sac tumor, mixed germ cell tumors. And so, surface epithelial tumor classification, we have the serous tumors, we have the mucinous tumors, we have the endometrioid tumors, we have the clear cell tumors, transitional cell tumors. So remembering the surface epithelial stromal tumors is difficult, but we can remember the sex cord stromal tumors and the germ cell tumor classification. So among the sex cord stromal tumors, we have the granulosa tumors, fibroma, ticoma, Sertoli-Leydig cell tumor. In the germ cell tumors, we have the teratoma, dysderminoma, yolk sac tumor, mixed germ cell tumor. Note this in a book, note this somewhere, but this is very important. So here the answer would be yolk sac tumor is a germ cell tumor, dysderminoma is also a germ cell tumor, non-gestational choriocarcinoma, even choriocarcinoma is a germ cell tumor, whereas granulosa cell tumor is not a germ cell tumor, it's a sex cord stromal tumor. So the answer over here is C. Let's practice a number question, because even simple mathematical problems can yield us 4 marks in our exam. Here, a young female weighing 46 kgs on digoxin with volume of distribution 6 liters per kg, clearance 4.6 liter per hour. Calculate the half-life of digoxin. If you simply know the formula to calculate digoxin, this is a very simple question. Pause the video here and solve this question. The options here are 4 hours, 68 hours, 42 hours and 0.9 hours. What did you get as the answer? So if you get 42 hours as the answer, that's absolutely correct. How did we calculate this? We calculated it by the formula T half is equal to 0.693 into volume of distribution divided by clearance. Here we can round it off to 0.7. Volume of distribution, here he gave us 6 liters per kg. Our weight was 46 kg. So 46 into 6 divided by clearance was 4.6, which comes out to be 42 hours. So if you simply know this formula, you could have got to the right answer. The thing is, practice number questions also daily, because these simple formulas can give us 4 marks in the exam, and the same has been asked in the INICET November 24 also. So I hope and believe you liked all the 4 questions, and revise the concept of ectopic pregnancy, and don't forget to answer this question for me in the comment section, because this concept is really important, as you know, and the other concepts also all have been tested multiple times in the NEET PG also. So if you are liking the videos, share it with your friends, revise these topics, like the video and subscribe to the channel, and see you tomorrow.